You don't see them. Make it as they log in, they like. They log in, they like. Okay, in okay. Welcome back. This is Gateway 101. And for the past 2 days now, we're talking about kidney disease, acute kidney disease, and acute and chronic kidney disease. So today we're going to be talking about what is kidney failure. We're going to be looking at the topic kidney failure. When we say that something failed, what constitutes failure? So we're going to be looking at that aspect, kidney failure. Okay, so kidney failure or renal failure occur when the kidney loses the ability to adequately filter waste, toxic, and excess fluid from the blood, often functioning at less than 15% of normal capacity. So when we say that somebody has a kidney failure, it means that the kidney has lost the ability to adequately filter waste or toxic. Remember that the kidney filters excess fluid and toxic from the blood. In other words, it purifies the blood. So when we say that somebody had a kidney failure, it means that the kidney has lost ability to adequately filter the waste, filter toxic and excess fluid from the blood, often functioning at less than 15% of normal capacity. So it causes a dangerous buildup of waste in the body, leading to symptoms like swelling, fatigue, nausea, and vomiting. So at this stage, treatment requires dialysis or a kidney transplant. So when you get to the stage of kidney failure, know that treatment required at this stage will be, please kindly subscribe and share to my YouTube channel. Please kindly subscribe and share. The good Lord will bless you. Thank you. So when we say that somebody having a kidney failure, it simply means that the kidney can no longer function adequately. Remember what we have been saying for the past 2 days now, that the kidney filter excess fluid from the body. The kidney also remove toxic waste from the blood. So if you have a kidney failure, it simply means that the kidney lost the ability to adequately filter waste, toxic, and excess fluid from the blood. So often functioning at less than 15% of normal capacity. So in each case, a dangerous buildup of waste in the blood, in the body, leading to symptoms like swelling, fatigue, nausea, vomiting. Treatment required at this stage of end-stage renal disease or kidney failure would be dialysis or kidney transplant. So let's look at some of the let's look at end-stage renal disease. So when we talk about end-stage renal disease, it means that end-stage renal disease, EXRD, is the final and most severe stage of chronic disease, or chronic kidney disease, I mean to say, when the kidney have lost almost all the ability to work. Remember, we're talking about kidney. We talk about acute kidney infection or acute kidney disease. They will have the chronic kidney disease. So those ones are reversible with proper treatment. But when it comes to the end-stage renal disease, in most cases, it requires kidney transplant or dialysis. So at this stage, the kidney can no longer, in end-stage renal disease, at this stage, the kidney can no longer remove waste and toxic from the body. Please kindly subscribe and share. Please kindly subscribe and share. The good Lord will bless you for doing that. Kindly subscribe and share. So at this stage, the kidney can no longer remove waste and toxic from the blood. So the kidney can no longer balance body fluid. The kidney can no longer control blood pressure properly. Remember that the kidney control blood pressure. So in end-stage renal disease, the kidney can no longer control blood pressure. The kidney, at this stage, the kidney can no longer maintain healthy level of electrolyte like potassium, sodium, calcium, phosphorus. The kidney can no longer, at the end stage of the end stage renal disease, the kidney can no longer maintain healthy level of electrolyte. So in end stage renal disease, in end stage renal failure, the kidney can no longer help make red blood cell. In end-stage renal failure, the kidney can no longer support strong bone through vitamin D imbalance. So waste and fluid build up in the body, which become life-threatening without treatment. So when does kidney disease become end-stage? End-stage renal disease usually happen when kidney function below 15% of normal kidney functions. So if your kidney is functioning less than 15% of its normal function, your kidney is coming to an end. So it's coming to an end stage. So it's becoming end stage. It can no longer function above 15%. The glomerular filtration rate is less than 15 ml per minute. I mean. So at that point, the kidney cannot support life on their own. So what are the common causes of end-stage renal disease? What are the common causes? The most frequent long-term causes include diabetes, is the leading cause of end-stage renal disease, followed by high blood pressure, hypertension, chronic glomerulonephritis, that is kidney inflammation, polycystic kidney disease is genetic, long-term kidney function or obstruction, autoimmune disease like lupus. Okay, so what are the possible symptoms of end-stage renal disease? As kidney function becomes very low, symptoms may include severe fatigue and weakness, swelling in leg, feet, or face, edema, present, shortness of blood, fluid in lungs, nausea, vomiting, loss of appetite, persistent itching, muscle cramp, confusion of double concentration, of trouble concentrating, decreased urine output, or sometimes normal urine early on high blood pressure that's hard to control. So how is end-stage renal disease diagnosed? It is diagnosed through drawing of blood. Your creatinine level will be drawn. Then your urine will be checked for protein. A little large bottle of potassium bicarbonate would also be checked. Kidney ultrasound laboratories sometimes check also. Okay, so treatment also for end-stage renal disease. Because the kidney can no longer do their job, treatment require one, dialysis. A machine or special fluid remover waste from the blood will be hooked to the patient to dialyze the patient. Dialysis is a blood filter through a machine. Peritoneal dialysis. No, that is hemodialysis. Hemodialysis is blood filtered through a machine, while peritoneal dialysis is a fluid clean inside the abdomen. So kidney transplant, kidney disease from a doctor replace a kidney function. Okay, so manage symptom and complication if dialysis treatment is not chosen. Okay, so why is end-stage renal disease serious? Without dialysis on transplant, end-stage renal disease can lead to dangerous potassium buildup, heart attack, fluid overload, lung, serious toxic buildup, uremia, and last stage death. Okay, so let us look at what is kidney failure. Okay, so let's look at what is dialysis treatment for kidney failure. So dialysis is a life-saving machine used when the kidney can no longer do their job properly due to kidney fractures. Okay, so think of an artificial kidney, support system. When kidney fail, waste products, extra fluid, and toxic buildup in the blood. So dialysis would be the only option because it helps remove the excess fluid that is built up. But you have to go to dialysis at least 3 times a month, depending on the severity of the kidney. So what is dialysis needed? Why is dialysis needed? Dialysis is usually started when kidney function become very low, often become very low. Severe symptoms of kidney failure appear, such as extreme fatigue, okay, swelling in both legs, sometimes face, shortness of breath, confusion, persistent nausea, vomiting, growing dangerous high potassium level. Type of dialysis, we have hemodialysis, that is blood dialysis. This is the most common type. How it works, it removes excessive fluid from the body. Okay, and blood is taken out of the body through a blue passes through a dialysis machine. So clean blood is returned back into the body. So what is done usually in a dialysis center or hospital, sometime at home, about 3 times per week. Each stage lasts 3 to 5 hours. Each session, lasts 3 to 4 hours. Okay. Access needed a special connection to blood vessels such as AV fistula, Beck's long-term oxygen, then graft catheter is also needed. Okay. So renal dialysis is the belly dialysis. This uses the lining of your abdomen, peritoneum, uh, pump water to your belly fluid, belly wise. Okay. So cleaning fluid, the peritoneal dialysis is a belly dialysis. This uses lining of abdomen, peritoneum as a natural filter. It's how it works. A cleaning fluid is put in the belly through a catheter, and waste passes from the blood into the fluid. The fluid is drained out and replaced. Okay. So CAPD done manually every several times a week. PAPD done automatically at night during using a machine. So these are signs, these are kidney, some system of kidney failure. Why this does not constitute treatment or cure yet. Okay. Okay, so why this does not constitute a cure or diagnosis, we strongly encourage you to see your personal provider because this is Gateway 101. Thank you for watching and bye for now.